Our topic today, yung large intestine channel of hand bright young 2. Okay, LI5, the location with the thumb abducted in a depression between the tendons of the extensor pollicis longus and brevis muscles. Anatomical snapbacks on the radial aspect of the wrist. So dito po sa may radial aspect. Sa point explanation, the fire point and grandmother point of the meridian, meaning that when this point is applied, energy flows not from the mother organ, the mother's cycle, but from the organ before the mother. These points work on the basis of controlling cycle. If the large intestine is a young organ, the control should be from within. So this point actually increases the yin in the large intestine. It is a good point to soften the stool and to calm the large intestine when it is irritated and inflamed. Next, we have the large intestine 6. Yung location po niya, 3 tune proximal to LI5 in the center of the anatomical snapbox. On the line connecting LI5 and LI11. So, i-align po natin sa LI5 and LI11, tapos 3 tune po pa sa may LI5 backward. Between the abductor pollicis longus and the extensor pollicis brevis muscle, at the level of the junction between the tendon and the muscle. Sa point explanation, the loop connecting point of the large intestine meridian, which draws energy from the lung, is coupled organ. It acts as a point to tonify the yang of large intestine, and considering its proximity to the bone, should be needled subcutaneously with skin pinched away from the bone and the needle pointing towards the elbow in the direction of energy flow. So, susundan po natin yung energy flow. Next, we have the large intestine 7. Yung location po niya is 5 tune proximal to the anatomical snapbox in the direction of the lateral end of the elbow crest at 1 tune distal to the midpoint of the line connecting LI5 and LI11. So, straight line lang po. So, connect natin LI11 and LI5. Then, 5 tune from LI5. Point explanation, LI7 is C-cleft point of the channel. It is used for treating acute condition of the organ. However, this is not used as much as the lower C point of LI stomach 37. So, yan po yung picture. Okay po. Next, we have LI10. The location is 2 tune distal to LI11. So, from LI11, 2 tune naman pa towards the hand. On line connecting LI5 and LI11 on the extensor carpi radialis longus muscle. A deeper insertion will reach the supinator muscle. Sa point explanation, this is not an energy balancing point, but a very useful one nonetheless. It is a common tender point in patients with tennis elbow and is used in these cases. It is also excellent as a one-point therapy, point for frontal knee and leg pain. So, LI10, yan po. So, sa picture po, yung i-align po natin yung LI5 and LI11. So, yan po yung dinadaanan ng large intestine meridian. Like LI7, 5 tune po yung from LI5. Tapos yung LI10 naman, from LI11, 2 tune po pa forward to the hands. Okay, yung LI11, sakto po dito sa my elbow. Nandito po sa mga pictures. Location. Location with the elbow flexed on the lateral end of the elbow crest in a depression between the end of the crest and the lateral epicondyle of the humerus on the extensor carpi radialis longus muscle. Sa point explanation, the tonification point of the meridian is an excellent point for enhancing the immune system. So, pwede natin magamit for enhancing the immune system. It works on the principle that tonifying an extreme yang organ will increase the yang and would cause intertransformation of yin if the yang is too high. So, pag mataas na po yung yang, magpapalit na po siya or lilipat na papuntang yin. So, ito po yung nakakatulong itong LI11. For this reason, one could use it in the treatment of high fever and high blood pressure. So, maganda po siya for the treatment of high fever and high blood pressure. From yang, matatransform na siya sa yin. So, we use LI11. Sa LI15 naman, the location in the depression distal and anterior to the acromion, sa may shoulder po, between the clavicular and acromial portion of the deltoid muscle. So, sa may shoulder, nandun po ang LI11. Sa point explanation, an important point of the anterior shoulder pain. So, pwede po sa anterior shoulder pain. This point is ideally used alongside a few other tender points in the areas such as tricol warmer 15, SI12, and LI14. Together, these points relax but strengthen the shoulder and relieve neck. Next slide. So next, we have the LI20. Sa picture po, yung location in the nasolabial groove at the level of the midpoint of the lateral border of the ala nasi. So dito po sa may nose. Sa point explanation, an excellent local point for nose and maxillary sinus problems. Black nose, pag may hirap huminga, sneezing, and irritation of the nose. Ideally, the LI20 points on either side of the nose should be combined with point extra 1, yung yin tang, all points given at 20 degrees angle to the skin pointing towards the nose. So, ang angulation po, 20 degrees and direction towards the nose from the three corners of a triangle. This is also last point of the meridian, after which it flows out of the large intestine into the stomach at stomach 1.